I haven't had sex for the past 7 years and I will be 30 this year. Is there a chance that I will have twins? I'm planning on having sex and getting pregnant this year. In today's video, I'll be answering all your fertility questions. If you're new to my channel, I am Dr. Amarachi Ijeoma. I am a fertility physician and my channel focuses on everything women's health and fertility. So if this is the kind of content you're interested in, keep watching. How long does it take to see my period after a miscarriage? The timing of the return of your menstrual cycle depends on various factors. 1, the length of the pregnancy. 2, the level of hormones in your body. 3, how your body responds to the miscarriage. In general, most women will have their first period at about 4 to 6 weeks after a miscarriage, but it is not uncommon for a woman to experience delay by several weeks to months. It's also important to note that your first period after a miscarriage may not be the same with your regular period. It might be different in terms of length and intensity. It may also take a few cycles for your body to regulate itself and for your cycles to become regular again. But if you're concerned about the length of the delay, please see your doctor. What causes delay in getting pregnant after miscarriage? So many things can cause it, including how soon your menses returns. So if you're not menstruating, then you're not ovulating, and if you're not ovulating, you can't get pregnant. So if your menses has not returned, that could be what's causing the delay in pregnancy. However, if your menses has returned and there's still a delay, it could be due to age, because as a woman gets older, her fertility declines and it may take longer for her to conceive after a miscarriage. And it is not because of the miscarriage that is taking her longer to conceive, but because she's aging. That's why it can take longer for her to conceive. Another reason can be certain medical conditions like PCOS, which is simply a condition that causes hormonal imbalance in a woman and prevents her from ovulating. So if the woman is a known PCOS patient and it is difficult for her to ovulate, she doesn't see her periods regularly, this can cause a delay in conceiving after miscarriage. Because after the miscarriage, she still has the PCOS. So it may take longer to conceive because of fewer periods. Another one is emotional recovery. Miscarriage can be a traumatic event for a woman. So she may need time to grieve, to recover emotionally before she's ready to conceive again. So these are some of the reasons a woman can have delay in conceiving after a miscarriage. How do I know if my cervix is open for sperm to swim in? I noticed after sex, some fluid runs down, so I feel sperm does not stay in. Hence, it's been difficult to get pregnant. What do I do? I have the same problem too. Please, what's the solution or medication for the issue? Please, I've been trying to conceive for the past 2 years, but it's not happening. Then again, anytime I have sex, all the sperm leaks out. I mean, everything comes out. I have been worrying. Doesn't mean I will not get pregnant. Please, how do I know that sperm has entered to fertilize? I notice fluid comes out after making love. So my last video is literally sperm leakage from the vagina, and what I talked about there is that it is normal for the sperm to leak out of the vagina because what a man ejaculates is semen. Semen is fluid, is the milky fluid that you see when a man ejaculates. But inside it is what you cannot see, which is the sperm. And it contains millions of sperm cells, especially in a healthy ejaculate. So these sperm cells are fast swimmers. They swim really fast. So no matter the sex position you're engaging in, or you stand up immediately after sex and you feel fluid trickle down your thigh, the best sperm cells have already gone into your uterus, into your womb. The reason is the sperm cells are fast swimmers. They swim really fast, so they go all the way into your uterus within seconds to minutes. So what you're seeing actually leaking out of your vagina is the liquid part, the part that is protecting the sperm cells itself. That's what you're seeing coming out of your vagina, alongside a few sperm cells that couldn't make it into the uterus, maybe because of the acidic environment of the vagina and it was too weak and it died, or it has abnormal shape, maybe 2 heads, 2 tails, or it's not a good swimmer. It's not swimming as well as it's supposed to. So if you're finding it difficult to conceive, best believe that it is not associated with sperm leakage, because it is normal for sperm to leak out of the vagina. So what you need to do is visit your doctor to get properly evaluated to find out what the cause of your delay in conceiving is. So no, there's nothing you can do to prevent the semen from leaking out of your vagina. So how you can know that your cervix is not tightly fused together to prevent sperm from going into the uterus is usually via what we call a uterine sounding. It's a painless procedure, slightly uncomfortable procedure. It's usually done with a slim metal instrument or plastic. We go in through the vagina and into your cervix. If we have difficulty getting into your cervix, then there could be some sort of adhesions or fibrosis going on in your cervix, and this simply means your cervix is fused together due to whatever reason. Ideally, we are supposed to go in smoothly. It's supposed to be like a 2 to 3 minutes procedure, and if we are having difficulty going into your cervix, then maybe there's something going on there that is causing a fusion, abnormal fusion of your cervix. So it's usually part of the examination that is done when you go to your fertility physician for evaluation of infertility. I saw my period on the 9th of last month, but I also saw it on the 17th of this month. Please, is that okay? If you mean 9th of February and then 17th of March, then from my calculation, that's a 36-day cycle. And that could be normal, but it depends. So it depends on what your normal cycle length is on a normal day. Generally, the normal cycle length is 21 days to 35 days. Some literature say 24 days to 38 days. So if we are going with the literature that says 24 days to 38 days as normal cycle length, then it's normal. But if you're going with the more popular 21 days to 35 days as the normal range, then it depends. How many times in a year did you have that 36 days? Is it once? Is it twice? Is it 3 times? And if it is just a few times, it could be due to several reasons. Stress, an acute illness, a recent event in your life. All of those few things, contraceptives, hormonal contraceptives, could shift and delay your period for a few days. Also, if this 36 days is your normal cycle length, that is, every 36 days you see your period, then that's your normal. That's normal for you. But if your normal cycle length is, let's say, 26 days or 28 days, and all of a sudden you started having 36 days, 37 days, 45 days, then we are looking at something. That's when we'll be bothered about an abnormal cycle length. But if this is not the case for you, then the 36 days could be normal for you. I had a 37-day cycle length month. Please, what do I do? I believe my explanation just now covers for this question as well. So, next question. I haven't had sex for the past 7 years. Now I will be 30 this year. Is there a chance that I will have twins? I'm planning on having sex and getting pregnant this year. I need a guideline. I want to conceive twins. Same here. According to research, there are natural factors that can lead to you conceiving twins or triplets or quadruplets or quintuplets, and these factors include height. So if you are tall, and they give a specific height, if you're greater than 5 feet 5, then you stand a chance of conceiving twins. If you are a female greater than 35 years old, you stand a chance of conceiving twins. If your race is black, then you stand a chance of conceiving twins. If you have a family history of twins, that is, you yourself, you're twins, your mom is a twin, your dad is a twin, especially your mom, then you have a chance of conceiving twins. If you fall into any of these categories, then you have a chance of conceiving twins naturally. I have been having a regular period, but in January 2022, my period lasts for up to 14 days before it stops. My period later stopped completely after seeing it in May 2022. Then saw it again in November 2022, lasted again for 14 days, then came out in January 2023 with lots of heavy blood clots with excruciating pain, and that lasted for 4 days. Came out again in March, lasted for 5 days. What can be the cause of this? Because my menses comes out every 2 months now instead of the normal 26 days. And my confinement is 2009, and I want to conceive again. What do? I am 47 years old. There are several reasons this could be happening, but I will focus on the most common reason for your age, which is perimenopause. Peri means around, so around menopause. This is the transitional phase into menopause. That is, you're transitioning into menopause. At this point, your body begins to produce less estrogen, and it is normal to experience irregular period during this transitional phase. As your hormone levels fluctuate, cycles become shorter or longer, bleeding becomes heavier or lighter. During this period, you can also experience hot flashes. That is sudden intense feeling of heat, like a wave of heat just comes to you, and it can be associated with sweating. You might also be experiencing mood changes, vaginal dryness, and it's also normal for some women to experience a lot of these symptoms, and some other women will not even experience any symptom at all, or they may just experience one and it will be mild. So because you're ready to conceive again, I will advise you to visit your fertility doctor so that you can both work together to find the appropriate treatment option for you. Can a 43-year-old woman get pregnant naturally? Yes. I get excited answering this question because I've seen it happen not once, not twice. Yes, it's not as common or as easy as a woman less than 35 years old, but it does happen. So there are many factors to look out for. Are you still seeing your period? Is it regular? What are your hormonal test results saying? Do you know how to calculate your safe period and your fertile period? So you know the right time to have sexual intercourse in order to get pregnant. Have you done any of these things? If everything is fine, you can get pregnant naturally. And if everything is fine and you're doing everything right and it doesn't happen within the next few months, visit your fertility doctor so that you can work together to find the appropriate treatment for you. Can I get pregnant at the age of 47 naturally? Yes, you can. I just answered the question. So, next question. What should I do to conceive after being diagnosed of fibroids and ovarian cyst, but advised to conceive 7 months ago? I just got married and in my 40s. Never tried to be pregnant ever, but with normal menstrual flow. Fibroid is not directly proportional to infertility. It depends on several factors. 1 is the size of the fibroid, 2 is the location of the fibroid, 3 is the fibroid complicated? Are you having symptoms, obvious symptoms? If the fibroid is really big, if it's greater than 5 centimeters, if it is located inside the womb, inside the uterus, where the lining of your uterus is, then it could affect fertility. It doesn't even absolutely affect fertility because your embryo can choose to implant on either side of your endometrium depending on which ovary released the egg. So if the submucous fibroid, that is the fibroid that is inside the womb, if it is on the left and it is very tiny, and you ovulate on your right, that is your right ovary releases an egg, then there's a high chance that the embryo will be implanting on the opposite side of the fibroid. So it doesn't stop your embryo from implanting and you getting pregnant. The cause for concern is pregnancy hormones has been implicated in causing the growth of fibroid. So as the baby is growing, the fibroid might be growing. Doesn't necessarily or absolutely have to grow, but might be growing. And depending on how fast the growth rate of the fibroid is, it could be affecting the growth of the baby. However, it doesn't absolutely have to affect the fetus. It could. It's a potential threat, but it doesn't have to. Sometimes it doesn't even grow at all. And this is the reason why when you have a submucous fibroid and you're pregnant, you have more visits to the hospital because your doctor wants to monitor you more closely. The reason submucous fibroids, that is the fibroids that are inside the uterus, have been associated with infertility is because if the embryo is supposed to attach on the same place that the submucous fibroid is, it won't be able to implant. So that is the association. So if your doctor sees a submucous fibroid and you're battling with infertility, most times, also depending on the size, they want to take it out to give you an increased chance of getting pregnant. But there are other places that fibroids can stay. It can stay in between the muscle of the womb. It can stay on the body, outer body of the womb. And in that case, it is not going to affect fertility, except it is obviously too big and it is taking up space and it is causing symptoms like heavy menstrual bleeding, prolonged bleeding. So you realize that on a normal day, you usually have 4 to 5 days of period or 3 to 4 days of period. And all of a sudden, you're bleeding for 14 days, 18 days, 21 days. Then that's the problem. They want to take it out because it could affect fertility as well. Fibroid is very, very common, and most women end up living normal lives with fibroids, because once a woman has reached puberty, she's at risk of having fibroids, and as long as it's not affecting her day-to-day activities, she's able to do whatever she wants to do without any inconvenience, without any excruciating pain or prolonged bleeding, then she doesn't have to do anything about the fibroid. Lots and lots and lots of women have ended up giving birth to multiple kids, 4, 5, even 7 kids with fibroids, and it's not affecting them. Fibroid is only to be treated, it's only to be managed when there are complications like prolonged bleeding, excruciating abdominal pain, or it is located inside your uterus and it is affecting fertility. So to address the ovarian cyst question, ovarian cysts can also be normal. There's something called physiological ovarian cyst. It can happen on some months, sometimes due to ovulation. When the bag of fluid that contains the egg in your ovary bursts to release the egg, the fluid that is released from that bag, the water that is released from that bag, can be seen as a cyst on the ultrasound scan. So the time of your cycle that you did the ultrasound scan matters. So if you did the scan a day to your ovulation, it's going to show a big cyst, because remember, the mature egg that you're supposed to ovulate, that you're supposed to release, is usually in the biggest sac of fluid on the ultrasound scan. That's also a cyst, because the term cyst means a sac of fluid. So most times, these normal cysts that you see, by the next month, ideally you shouldn't see them. If they're still there, by the next 2 months, ideally you shouldn't see them. By the time you start having these cysts persisting over and over and over again, month by month, then you want to see your doctor, because that is not normal. So there are also other types of cysts. I don't want to go deep into it because of time, but you need to ask yourself this question: how many times have you done that scan? Was it just once you did a scan and you saw cyst? That could be a normal cyst. But if it is multiple times, year in, year out, that you've seen the cyst, then that's a cause for concern. A lot of the time, this cyst can be managed, but there is one particular type of cyst that can cause difficulty in conceiving, and that's endometriosis. When endometriosis gets to the ovary and causes a cyst there, we call that endometrioma, and this can cause difficulty in conceiving. You need to see your doctor. Usually the woman will complain of severe menstrual pain every month, like whenever she's seeing her period, excruciating, debilitating pain. So the part about you being 40 years old and trying to get pregnant, it is possible, but you have to be proactive, especially since you have fibroids, ovarian cysts. You need to get those checked out. So work with your doctor very closely to see the best appropriate treatment for you. No menses for a year after IVF. Really need it back. For those of you that don't know what IVF is a form of fertility treatment that involves advanced technology. It involves taking the egg out of a woman's body, taking the sperm out of a man's body, putting the egg and the sperm in a dish, allowing it to fertilize in an incubator for about 3 to 5 days, and then carrying the resultant embryo, because when they fertilize, they'll form a zygote and then an embryo, and then we'll carry that embryo and then put it back inside the woman for it to implant inside the woman's womb and then become a baby, become pregnancy and then a baby. So back to the question, not seeing your menses a year after IVF might not be related, but the question is not completely clear. Was the IVF successful? That is, was the pregnancy test positive? Did you carry the pregnancy? Did you give birth? And after that, you haven't seen your period, because in that case, it is normal for your period to be delayed about 6 months to about a year after delivery. But if the IVF wasn't successful, that is, the pregnancy test was negative, and 1 year after that, your period has not returned, it could be as a result of menopause, which typically occurs between the ages of 45 and 55 years old. If you're less than 45 years old, it could be as a result of PCOS. If you're a known PCOS patient, that is a hormonal disorder that causes very few periods or absence of periods in general. Or it could be premature ovarian failure, which is a condition where the ovaries stop functioning before the age of 40. It could be so many other things. If you've not seen your period for up to 1 year, you should see your doctor. I am experiencing loss of menses for the past 7 months and not pregnant. What can I do to get it back? I believe I just answered this question. It's basically the same thing. So there are several causes of amenorrhea. Amenorrhea simply means not seeing your period. So if you've not seen your period for up to 7 months, it could be any of these things I just mentioned and more. So you need to see your doctor so you can be evaluated, the cause of your amenorrhea can be found, and then the treatment, appropriate treatment, because the treatment will depend on what is causing it. What is PCOS, and do you know about Ramona capsules for a person trying to conceive? PCOS is polycystic ovarian syndrome. It is a common hormonal disorder that makes a woman not to ovulate, and is usually diagnosed when she has 2 out of these 3 criteria. 1. Irregular periods, that is having about 4 periods to 8 periods in a whole year, or no periods at all, or lesser than 4 periods in a whole year really. 2. Increase in male hormones called androgen, and this can cause increased hairs on your body. That is, you start having hairs on your chin, hairs on your face, hairs on your chest, hairs on your lower abdomen, and other parts of your body. Also causes acne, plus or minus weight gain. 3. Multiple small cysts on the edge of your ovary, which can be seen with an ultrasound scan. So if you have 2 out of these 3, then you will be diagnosed with PCOS. Ramona is the brand name of a supplement. Had to Google it to see that it is being marketed as a supplement that helps to regulate your cycle. I did more research and saw that there is limited scientific evidence to back up its use, to support its use. So make sure you consult your doctor to see if it is safe for you. But what is recommended though is, if you're overweight, maintain a healthy weight. Try to lose weight. It could help. And there are certain medications that, depending on your goal, will be given to you, will be prescribed to you by your doctor. So if your goal is to reduce the amount of acne on your face as a result of PCOS, or to lose weight as a result of PCOS, or to reduce the hairs on your face, on your body as a result of PCOS, or if your goal is actually to get pregnant, you're ready to get pregnant, then depending on what your goal is, you'll be given the appropriate medication. So before using Ramona, please consult your doctor. Discussion on PCOS. I've already answered that. Can someone with PCOS take Dufastone to regulate her cycle? Dufastone is a progesterone tablet. It can be prescribed to patients with PCOS to help regulate their cycle. It is important for you to note that medications should always be prescribed by your doctor after a proper evaluation. Dufastone might not be suitable for everyone. Some women might require a different type of medication or a combination of medications to help manage their PCOS. PCOS abdomen weight gain. The weight gain seen in PCOS is usually due to the increased male hormone, the increased androgen in PCOS, and it is typically on the abdomen. Weight gain in PCOS is usually difficult to manage and may require a combination of lifestyle changes and medical treatments. For example, your diet, your exercise. You need to start doing exercises. You should pay more attention to your diet. It should comprise more of leafy vegetables and fruits. And then medications to help regulate the hormonal imbalance. Usually this requires routine visits to your doctor to help. It's usually an individualized treatment. It is not the same treatment for every PCOS patient. The physician, the doctor, will work with you to know what's best for you to help you achieve your goal. And if your goal is weight loss, if you're having weight gain as a result of the PCOS, then they will work with you to figure out the best method for you. I'll be stopping here for today because I believe that this video is extremely long, which is unlike my regular videos. If you've enjoyed today's video and you want more content like this, please subscribe to my channel, like these videos, put your questions in the comment section below, and see you in my next video.